Hello, welcome to the Beasley Equine Podcast. I'm your host and equine veterinarian, Dr. Travis Beasley. Today, we're going to talk about emergency care. If you got horses, you know that emergencies happen all the time. We're going to go over some of the basics on what to do, what not to do, when to call, how to call, and what to do before you get to the vet or before the vet shows up. So stay tuned.
Veterinary surgeon or start to come quick. Draw the syringe and give it a flick. Bring your little black bag with the medicines in. Bring the trank and the crank and the penicillin.
All right, I'm going to go through some stuff based on some AAEP guidelines here. And like I said, if you have horses, you know they are prone to injury. They invent ways to hurt themselves. I tell owners all the time that horses have two things on their mind: homicide and suicide. If they can't hurt themselves, they're going to hurt another one. So as a horse owner, it's important to recognize what's serious, what actions to take right away while you're either waiting to go to the vet or waiting for your vet to arrive. So we're going to go over some of that today. We're going to talk about the most common types of emergencies, including colic, lacerations, lameness, eye injuries, allergic reactions, choke, and just touch on foaling a little bit. It's getting to be springtime in Illinois, so we've got some babies hitting the ground, so we'll briefly talk about that. It's important to know when your horse is in distress. It's great to have people look at their horse every day and kind of know what's normal for them, but the biggest thing we see is horses with decreased appetite. If your horse isn't eating, there's probably something wrong with it. So we're going to talk about the steps to take and then everything to do before you call your vet. Or if your horse is just lethargic, kind of moping around, not acting like himself, they might be laying down longer than normal, where they're normally up in the stall ready to eat. They may lie down. You may see them out in the field by themselves laying down. These can be some signs that something's going on with your horse. And, of course, there's sudden lameness, and that one's pretty obvious if your horse is limping really bad on a leg. And we'll talk about eyes, too. Eyes are something that we consider every eye thing an emergency. We like to see it the same day as soon as possible, and we'll have owners text us pictures so we can kind of know. Some things, we may be able to put off for an hour or two till I'm back at the office. Some things we'll try to see even sooner. But any eye thing we treat as an emergency. And some of the eye stuff is very subtle. Some of it's just a little bit of tearing, maybe squinting a little or holding the eye closed. Call your vet if something like this happens. Don't just try to use we just got a ding in the ear. Don't try to use some ointment you found in there. Don't go squirting stuff in his eye, because a lot of times they're painful, and that just kind of gets him a little bit head shy if you're putting stuff in there that could irritate it. And then always have a thermometer. If your horse has a fever, you need to call the vet because something's going on. And look at their gum color. I would recommend looking at it on a normal day just to kind of get used to what your horse looks like and feels like with their gums. You just flip their lip over and stick your thumb on there and see what it looks and feels like. And planning ahead, this is huge. You need to have a plan in place for when your horse gets hurt. So have your vet's phone number ready and have a relationship with the vet. If you're not using one routinely, you may have trouble getting one out right now with the current state of the shortage of vets. So use a vet, use them often, have a good relationship with them. They'll know your horse is good, and they'll be able to help you when there's an emergency. And they'll answer their phone. And the other thing is stay safe. Some of these horses, if they're real fractious, if they've hurt themselves, just be a little leery. And especially colic horses, they can go from standing relatively still to get uncomfortable and lay down and kind of act really erratic. Or if it's really bad, you can't control them. We've had them run through the sides of barns. And just keep yourself safe, because that's the last thing we need is an emergency with a human too. And a natural disaster plan, I'm talking about like flooding or fires, tornadoes, etc., which we won't dive too much into that. We'll do a future podcast on that. And there is some guidelines on AAEP.org for you horse owners for that too, with natural disasters. And we need to talk about transport. If you don't have a trailer, you need to have access to one where somebody can haul your horse. It's so much better to work on a horse in a clinic or hospital setting. There's so much more we can do. Now, understand Sometimes a horse is down. Sometimes you may not be able to move the horse, and we have to go out in those situations. But most of the time, I'd say over 90% of the emergencies we like to have in the clinic. I have x-ray, ultrasound, blood machines. I can call in help. It's a more sterile environment if we got to do anything. And any of the unexpected stuff we'll have here, and I may not have everything on my truck at the time. Then with the trailers, if you have one and you don't use it very often, check the tires, check the brakes, check the lights, make sure you're not going to have a blowout on the way, and make sure that trailer's safe for farther travel than just the vet. On certain things, we may have to refer a horse to a hospital for more advanced and time-consuming treatment or even surgery. So, and the closest referral center we have is about 3 hours away from us, and that's not uncommon for most part of the countries, is having to take a pretty long ride. So make sure your trailer's safe, keep the tags on it, check the tires. I mean, even if they look good, they can dry rot sitting there if it's not used much. So have your trailer ready, because that can be the difference between life and death in your horse and sometimes. So if you have an emergency, out of those things we mentioned previously, the first thing to do is assess the horse. Make sure he's safe to approach. Like I said, the colics that can be going crazy, it may be a little bit dangerous to go up to the horse. So if you can catch it, calm it, talk to it, your horse is going to be used to you. You can calm it down, pet it, and if possible, move the horse to somewhere safe, like its stall or a small paddock. And if it's at the night, somewhere where there's plenty of light, if somebody has to come out, and get someone to help you, especially if it's a wound you got to look at. Having somebody stand at the head can keep you safe while you're doing anything necessary before you load it or before your vet arrives. Assistance is always helpful. And that's the other thing, is if they come into the clinic with these emergencies, I can always call in help, and they can get here sooner than they can get to your place most of the time. And the other thing that's good to have on hand besides just a trailer is a first aid kit. Our clinic actually builds them. And with horses that we've seen routinely, we have some prescription drugs we can put in there too. But if you're going to make one on your own, at a minimum, we'll recommend gauze pads, roll cotton, brown gauze, adhesive wrap, leg wrap, scissors, white medical tape and duct tape, a stethoscope, a thermometer, a hoof pick, some type of surgical soap, whether Chlorhex or iodine, a little bit of eye wash in case there is a bunch of goop on your horse's eye, an antiseptic solution, some latex gloves, not just to protect your horse, but sometimes for your protection in cases, and a flashlight and some batteries too, in case something happens at night or you're traveling. And it's also important to know what normal is. And there's normal ranges for all horses, but there's also a normal range for your horse. So if you're out feeding or just routinely, it's great to just know what's normal for your horse. And then you can tell your vet, well, his heart rate's usually this, and today it's this. I usually hear these good gut sounds. I'm not hearing any. His temperature's normally 99, but today it's 101. And again, with the gums, you can just lift their gums up, push on it. They should be moist and pink. And we call it a capillary refill time. You can push your thumb on there, and you'll blanch that pink skin or the pink mucosa. And when you release, the blood should fill back up in there less than 2 seconds. Most of the time, it's closer to 1. And if you stick your hand in there and it's tacky, that could be a sign of problems. So if you get a stethoscope, that doesn't do any good if you don't know how to use it. So I guarantee you, if you bring a stethoscope to your vet, they will more than be happy to show you how to take a heart rate and listen to everything. Because when you call with an emergency, that's great knowledge for us, because we can tell how bad it is, how big a hurry we need to be in, or what exactly is going on, and we can kind of warn you in advance what we think. And horses, depending on your horses, how in shape they are, sometimes you can hear all 4 beats of the heart. So sometimes they can be a little bit tricky. But in a horse that's got an increased rate, you'll hear that lub-dub, and you can count them. And heart rate, respiratory rate, you can watch their flanks, or if they're breathing hard enough, their nostrils are flaring, you can count those. And the same with the heart rate. You can count for 15 seconds and then multiply it by 4, and that gives you how many breaths or beat per minute. Or count for 20 seconds, multiply it by 3. Count for 30 seconds, multiply it by 2, or you can count the whole minute too. And one thing with the heart rate, and we see that a lot in here, your horse may be more comfortable with you, but In the clinic, sometimes the first time I walk up to the horse, they're in a strange place. They know they're in distress. Their heart rate may be a little bit increased at first. So I'll usually listen for a little bit until it kind of normalizes and slows down a little. Then I'll get my heart rate. And gut sounds too. A lot of people stick their ear up to the horses. That's not that accurate. It's better than nothing. But use your stethoscope and check every quadrant. We'll talk about that a little bit with the colic. And again, the mucous membrane color, the capillary refill time, and know your attitude and appetite of your horse. If he did eat, if he didn't eat, and if he's just acting different than normal. So to take a temperature on a horse, we do it rectally, and a digital thermometer works great. That's what we use. I will caution you on some of the quick thermometers. There's some human ones that are 3 seconds, I think. Those don't work too good. Somewhere in that 8 to 10 second range is what I've found is the most accurate and closest to a mercury. And a normal temperature for a horse, if you look in the textbooks, is 99.5 to 101.5. Most of the ones we get in here, unless it's a really cool or hot day, they cruise right around 100. So sometimes we'll consider 101.5 a fever. But again, if you take your horse's temperature consistently, you'll know whether that temperature is trending up. And just be careful when you do it. Have somebody hold the head if your horse is a little bit shy back there. Scoot the tail over and stick the thermometer in there. If you get a really low reading, sometimes you can be right beside or inside a fecal ball, so you can just kind of move around and check that. Normal heart rate for a horse is anywhere between 28 to 44 beats per minute. Again, you can count it and then multiply it. You don't have to stand there for 60 seconds. And where you take it is the best place is behind the left elbow, and you kind of got to put it in there pretty far. But if you talk to your vet, they'll show you, and I think we got a YouTube video on how to take a heart rate too. And the respiratory rate, normal 12 to 16 breaths per minute. And again, you can watch their flank, breathe. You can stick the stethoscope on their windpipe, which is the whole distance of their neck on the very bottom. It feels about like ours. And you can stick the stethoscope on there, and you'll be able to hear the air go by it and back, and you can count those. And sometimes when I do that, I'll put the stethoscope on the trachea and the hand on their flank and make sure everything's kind of matching up and get an accurate respiratory rate that way. And the capillary refill time and mucous membrane colors. The skin test in horses for hydration is not accurate, hardly at all. The best thing we can do without blood work, flip their upper lip up right above their teeth, push it with your thumb. You can push pretty hard. When you pull your thumb off, it'll be kind of whitish, and then it should refill to that normal color that's around it in less than 2 seconds. If it takes longer or it doesn't feel moist, it's kind of tacky, that can be a sign of dehydration in your horse. And then again, gut sounds check all 4 what we call quadrants, so the left and right side, upper and lower, and it's kind of just in front of and below the point of the hip and the flank there for the upper, and then the bottom you can kind of go not all the way on the bottom, but kind of on the side in front of the stifle there. And if you can get all of those things and call your vet with that information, you might become one of their favorite clients. To have all that information that you can tell them right away, so we can get a good idea of how urgent it is and what we may or may not need to get ready before we see your horse. So we'll talk about colic first. That's probably one of the most common things we see after hours, and it's important to recognize the symptoms of colic. Anybody that's had a baby probably dealt with a little bit of colic. Colic is just an umbrella term for abdominal pain, and there is hundreds of reasons why these horses colic. It could be stomach ulcers, the intestines could be inflamed, they can displace where they're not laying where they're supposed to be, they can flip where they're not supposed to be. They can get what we call impactions, which is where you've got a bunch of hard dehydrated stuff that can't move on. And they can have foreign bodies in there. They can have like petrified turds, basically, interoliths or big balls of mineral in there. Or sand. I mean, there's a lot of reasons horses colic, but all of the symptoms are usually the same. Some of the subtle ones, a lot of them, they just don't feel good. They got a tummy ache, and just like us, they don't want to eat. So if your horse isn't eating, the first thing to do is take its temperature, and if it doesn't have a fever, then colic's pretty high on the list. Some of the other subtle signs or what we call flank watching. You might notice your horse just kind of turn its head and kind of look at its flank. That can be a sign of colic. Some of them will do the Flehmen response where they flip their upper lip up. And again, if you know your horse well, we got some owners that can recognize these signs right away. Like, hey, my horse just does this before he really gets into a colic episode. So really observing your horse is important for this too. And of course, the signs of more severe abdominal pain, the horse paws, rolls, gets up and down, and just generally uncomfortable. And when you call the vet, again, if you've got your little physical exam, heart rate, everything, the other stuff to tell them is if you've changed anything feed-wise, because we all know how particular horses are. Sometimes changing hay or changing diet kind of gives us a clue of what's going on and what to get ready before we see your horse. And any other information, if you got a good relationship with your vet and he's seen your horses often, he's going to know what's going on with your horse, whether it's pregnant or we've just vaccinated or dewormed. But if you do that stuff yourself or you've got to call a vet that doesn't normally see your horse, just inform him of all that too. And the heart rate and gut sounds. And we spend a surprising amount of our time looking at and talking about poop with colics. So when you're cleaning the stall, look at your horse's poop when they're normal and kind of get an idea. They should be nice big fecal balls. If they ever get real small and hard, that can be a sign of dehydration, which can lead to impaction colics. And then if your horses are out, then, maybe just watch them. You can't tell whose manure is who, but at feeding time, sometimes they'll poop and defecate, and you can kind of get an idea of what's normal for your horse. And the other thing we'll stress is if any of this is going on, just call your vet. Don't call the neighbor. Don't get on Google and try home remedies till midnight. Just call your vet. And if it's something that they don't think they have to see, they can probably tell you that based on the physical exam you do. And the earlier we see colics, the better success we have. By the time they're showing signs with things like impactions, like the pawing and rolling, we're pretty far behind the 8-ball. We got some clients and trainers that will have us come tube their horse with laxatives just based on the fact that the fecal balls have gotten small, and try to prevent that midnight colic call or walking out in the morning and finding your horse down and in miserable shape. So colic it can be serious, and the earliest we treat them, the better. And the other thing is know whether or not surgery might be an option for your horse. Know where the closest referral hospital is, and know the price. The closest one to us, they'll quote anywhere between $8,000 and $10,000 for a colic surgery. And that's kind of if everything goes good. That's kind of the routine one. If they got to get in there and remove pieces of intestine or there's complications afterwards, that price can go up from there. So either insurance, things like care credit are great, and have a budget for it, but also know whether or not you're going to do that. That can kind of help guide us on what we do, because there's certain things we will and won't do for horses that's going to surgery. For instance, if we think a horse has to be opened up for an impaction, most surgeons despise mineral oil because it gets in there. And when they do colic surgery for impactions, they actually will take that piece of intestine, that part outside of the horse, and set it on a table, open up that part of the intestine and flush it out. And if there's mineral oil in there, that gets all over everything, all over their equipment, and then can get on their gloves and everything, and it just makes a mess for surgery. So if we know that's an option, sometimes we won't reach for oil. We don't use it too frequently anyways. We got some other laxatives we use. But that's kind of the basics on colic. And now we're going to move in to what horses are also great at doing, is hurting themselves with wounds. And a lot of time it's the legs. So it's important to know when to call the vet with these. A little bitty superficial scratch isn't nothing. It's always good to call your vet if you got a good relationship with them. A lot of clients text us like, does this need to be seen? And we can kind of give them a good idea. But it's a great idea to have any wound looked at. But knowing when to really freak out can maybe save you that emergency feed. And the other thing too is the farther down the leg you get, there's a lot less tissue between the outside world and some really important structures. We see a lot of injuries that are in the pastern that look superficial, but they may get into a tendon or the tendon sheath or the joint, especially in the pastern area. So I would cautious you on that. Like anything, anything lower limb, try to get your vet to look at, because the earlier you intervene on some of those bad ones, the better off you are before infection can set in and everything like that. And let's talk a little bit about bleeding. Like I said, there's not much protection between the inside of the horse and the outside world on the lower limb. Just a little bit of skin and tissue before you get some really big arteries and veins down there. So a little cut can cause a lot of bleeding. And there seems to be two type of clients. Ones that say, oh, it's not so bad, and we see it, and it is really bad, or the ones that say he's cut his leg off and it's a little bitty scratch. And it can look like a lot of blood when they cut some of these things down there. So try not to freak out. Your average horse probably has, 1,000, 1,200 pound horse probably has 10 to 12 gallons of blood. And it's not that big a deal unless they lose about 2 gallons, which doesn't seem like a lot, but anybody with kids who spilt milk, which is a gallon, a little bit of that milk looks like a ton. So try to stay calm if your horse is bleeding, and we got to stop that bleeding pretty quick. And that's the thing that a lot of people call about. What do I do? If you got that emergency kit ready, you've got everything you need to stop a horse from bleeding. The biggest thing is pressure. If you can clean it a little with even a garden hose, that'll be fine. But the biggest thing is just get the pressure on there. Put a sterile pad. If you don't have that, a clean towel, even stuff like maxi pads work pretty good. Get some pressure on there, and then you can put a bandage on there. And we've got some videos on how to bandage limbs, because that's kind of the most common place that they cut and bleed a lot from. And that's sometimes the first thing we do when we see a horse, and then we may, if it's real swollen, address it the next day with surgical intervention. The other thing horses love to do is impale themselves with foreign objects, especially like pieces of wood or anything out in the field. I don't know how they find it, but they do. So if your horse gets impaled with anything, try to resist the urge to pull it out. If you can leave it in place till the veterinarian shows up, sometimes we'll take x-rays to see what's involved, or ultrasound to see what the rest of that object looks like, and removing it can sometimes cause a lot more damage than it being in there. If you pull it out, sometimes we'll actually have to surgically take it out to prevent trauma to other tissues. We had a horse come in one Sunday afternoon that had been shot by a crossbow through its back. And that's the first thing I told those people is don't touch it. They walked the thing in, and it ended up being a broadhead, which we found with shooting the x-ray. So if they would have pulled that thing out back through the spine, it would have done way more damage. We actually, I used the ultrasound and made an incision down to the broadhead and grabbed it with hemostats and unscrewed the arrow from it and pulled that out and then cut down and got the broadhead out. But if they would have tried to push it out like you see in the old Westerns or pull it out, I don't think it would have been the same outcome. That horse is still alive, and I think they still ride it too. So resist the urge to pull out foreign bodies, and if you can take pictures, send it to your vet. And it's amazing how well some of these do and how they miss important structures. Horses tend to get lucky even in those unlucky situations. So if you got a foreign body, leave it in place, call the vet. If you got one with a wound, you can always take a picture first. That way it can help us decide what to do before we unwrap it and get pressure on that wound and wrap it and try to stay calm. The other thing horses are great at doing is finding nails and stepping on them, or welding rods or screwdrivers, horseshoe nails. We've seen it all, even deck screws through the top of the foot. But when they step on stuff, their sole's pretty hard, and then that soft part in the middle back by the heels is a little bit softer. So a lot of times the nail kind of slides along the sole till it gets to that soft part and goes in the foot. And there's, again, not much space between very, very important structures and the outside world. And this is something else I'll stress, just like any other foreign body, try to leave that nail in place. It's very tempting to pull that thing out. But what we want to do when we see the horse is take an x-ray and see exactly where that nail is going. Because they can get into the coffin bone, they can get into the navicular apparatus, they can get into the tendons or the tendon sheath. And it's very hard to tell, even though we have probes and special stuff we use, it's hard to tell exactly where that thing went. And where it goes guides our treatment, how aggressive we're going to be or how conservative we're going to be. If some of it's sticking out, we'll tell people to put a towel on there, something soft. Most of the time, the horse isn't going to, the damage is done when he does it because it's going to go as far as it's going to go, and he's not going to put any more pressure on it. But if you got to bring your horse to the vet, you can get a big soft towel, plenty of padding, and get it to stay on there with a little duct tape or vet wrap, and get the horse in right away. And even if it doesn't look like it goes very far, a lot of these have complications down the road, and we do get pretty aggressive with these things. And what we call a street nail, if it goes up and hits that navicular area, those can be catastrophic. And the sooner we intervene, the better. We'll do stuff like regional limbs, soak in the foot, and then depending on where it went, antibiotics. But resist the urge to pull that nail out until you get an x-ray. The most other common thing we see are eye injuries. We've had a rash of those this winter, and they can be, like I said earlier, pretty subtle at first. I tell people a lot to look at their horse straight ahead and look at their eyelashes. They should be like a mirror image of each other, the left and right eye. And if a horse is hurting on one, that may be the first thing you notice is they're squinting just a little, and it may just be the difference in that eyelid lowering a few degrees in angle. Obviously, the bad stuff you're going to notice right away if your horse is squinting or if there's a ton of mucus coming out, they're holding the eye shut. And of course, lacerations to the eyelids. We see those a ton. They're good at hooking them on buckets, rubbing and cutting everything. And I've seen people cut the little skin flaps off and cut part of the eyelid off. And don't do that, because then the horse can't blink good. It can't clear its cornea off, and you get a lot of complications down the road. And most of the time, these things can be salvaged and saved, even if it's some of the tissue's dead, and even if it's a day or two later. Sometimes we have success doing that. And treat every eye thing as an emergency. These eyes can go from salvageable to worst case taking the eye out literally overnight, depending on what's going on. And resist the urge to go get that little bit of ointment that's left over from another horse, because with certain conditions, certain ointments will hinder and hurt healing. Depending on what's going on and what you have and how we know your horse, we may recommend you do something in the meantime until we can see it. But again, we try to get every eyeball in the same day because we really do our best to try to save these. So just call your vet right away. Get some good pictures. Most everybody has smartphones now, and if you can text your vet, that's great. That gives us a real good idea what we're working with and how big a hurry to get in. The other thing that might happen to you as a horse owner is you walk out one day and your horse looks like it has a broken leg. It won't put any weight on the leg. It'll be hopping, toe touching. The most common thing we see are hoof abscesses or subsolar abscesses, and that's also the best case scenario in horses that come to us like this. Usually no big deal. If we can find the abscess, open it and drain. But the other thing that can happen, we have had fractures. I always think horses like this are an abscess, but we get burned every now and again, and we go out and it really is a broken leg. So anything like this, call your vet right away. Sometimes we'll have you soak it overnight if it's late, and then we'll see it the next day. But we can kind of get a good idea based on what you tell us or pictures, whether it's a fracture or not. And it's getting ready to be springtime, so we'll talk about laminitis or founder. A lot of horses will do that from the sugar. Founder or laminitis is inflammation of the lamina, and that's what holds the coffin bone, or that bone inside the hoof capsule, to the hoof. And there's lamina on the coffin bone and the hoof, and they kind of interdigitate. And it's essentially how our fingernails are held on. So laminitis is inflammation. Lamina is that lamina we talked about. So laminitis is inflammation of that lamina, which if you've ever hit your fingernail with a hammer, you can probably know how these horses feel. And that's with our hands just standing there. They're putting, 40 or 60% of their weight on this front end or back end. So you can see why they'd be so uncomfortable. And with laminitis, most of the time, it's either the two front feet or all four. And the classic thing is they'll rock back. They'll put their feet way out in front of them to get the pressure off the front of that coffin bone. and they'll rock back. And if you try to turn them, they'll rock back. So that's something to keep in mind. And depending on why they founder, sometimes we have great luck treating these, but sometimes we don't. Ones that like grass founder or your metabolic horses, a lot of times those we can nurse through these laminitis episodes and keep the coffin bone from rotating. Laminitis secondary to diarrhea or retained placenta, those usually don't go as well. But again, just like any other injury or emergency, the sooner we can treat it, the better. And our goal is usually get inflammation or the itis part out of that horse's foot and keep that coffin bone from moving inside that joint capsule. On the bottom of the coffin bone, there's a big tendon that runs down there called the deep digital flexor tendon, and that goes all the way up the back of that leg to some of those big muscles, and that's kind of the driving force. And that the flexor tendon is constantly pulling on that coffin bone. And if the lamina that's holding that coffin bone in place gets inflamed, that's when that coffin bone can start to rotate. And worst case scenario, if enough of that lamina lets loose, we'll have what we call a sinker, where the coffin bone not only rotates in the hoof capsule, but starts going down towards the bottom of the foot. We had a recent case of it was a mare that aborted, but the foal had died late-term pregnancy, and she basically got an infection in there, and that's what caused the founder. And we tried everything, but eventually her coffin bone started to come out the bottom of the foot, and we had to unfortunately euthanize her. So again, if you see any of those signs, call your vet right away, and we'll initiate treatment. And the other thing that can cause some sudden lameness are tendon or ligament injuries. If your horse rips a tendon apart for whatever reason, those can present pretty sore pretty quick. But most of the time, it's a foot abscess. And most of the time, even broken legs, people say, well, we can't load it, it's not walking. Most of the time, they can get in a trailer because, again, with solo practices like me, we usually have appointments in the clinic all day, and it may be a while before we can get out. We may not have radiology equipment with us. So if you can get your horse loaded, that's the best thing to do. That way we can take x-rays and stuff. And depending on which leg it is, you can kind of load your horse different. When you're driving down the road with a trailer, one thing you can control is your acceleration. One thing that's hard to control is how fast you got to stop sometimes. So if it's a front leg, sometimes we'll have the horse face backwards in the trailer in case they do have to stop fast. They can use the hind end. Or if it's a back leg, we'll face them forward. Or if it's not too bad or a slant load, you don't have any other options. And then if we think it's a fracture, we will not try to move those horses. We'll try to come out and put a splint on and get some images. So again, that's where having a good relationship with your vet and one you can text or email pictures to, that kind of helps us see whether it's a fracture or an abscess. A lot of abscesses will actually toe touch and stuff like that. Or the founder, some of those will tell you what to do in the meantime, and we'll keep the horse there and go. The other thing you can check for laminitis is the heat in the hoof, and you can compare the other feet to it. If it's both front legs, you can compare it to the back. And then those big blood vessels and arteries we talked about earlier that go down to the leg, we call that a digital pulse down there. Basically, the pulse down at the digit or the foot. And that's another great thing I should have mentioned earlier is checking your horse's digital pulses and knowing what's kind of normal for them. Because if they've got a lot of pain or inflammation in those feet, the horse's body is going to send more blood flow down there. That's part of it. So the pulse becomes much stronger or bounding, and it's going to feel a lot more intense than it does on a normal day. We do have a YouTube video on checking the digital pulse. So you can check that out and kind of get a good idea for that. And again, your vet will be happy to show you how to take that. So in the case of emergency, and they ask you, does it have a digital pulse or is it increased? You can have the information to tell them. And we'll talk about allergic reactions too. Again, it's getting ready to be springtime, and this part of the country, we have lots of weird bugs, and we'll get calls weekly. Horses broke out in hives. Sometimes they'll be breathing hard. Sometimes they're itchy. And that's something to call the vet about too. Depending on the severity, sometimes we'll treat with a little bit of steroids and go from there. But that's the important thing about that relationship with your vet. Some steroids are great for allergic reactions, but some horses don't need steroids. You can risk side effects like laminitis or founder. So, but if we know your horse well, we know he's in good shape, he's not at risk of that, sometimes we can prescribe it and get you over that without an emergency fee. Some of the allergic reactions happen on the head and they can swell. Those are a bit more concerning than just a little bit of hives, because some of those head structures swell. They can have trouble breathing and stuff like that. So allergic reactions, always a good idea to call your vet and have them help through it. And a lot of what we see around here is insects, and sometimes it's just one side of the horse that's up in whelps. Sometimes in the barn situations, it'll be the horses on the outside stalls and the door were open where a swarm of insects comes through and gets them. So call your vet whenever you have allergic reaction. And signs of that are the hives, breathing hard, any swelling like that. Another common thing we see is choke. Horses are a little bit different with humans in what we describe choke. When humans choke, we get something in our windpipe and we can't breathe, which can happen to horses. But the classic choke in horses is food stuck in their esophagus. A horse's esophagus is super long. It's like 4 or 5 feet long from the bottom, from the top all the way down to the stomach. And horses that maybe have bad dentition or bad teeth, that are older and they're smooth, can't grind their food up as much. They're a little bit more risk to that because there are bigger food particles getting in there and they can kind of get bound up in the esophagus. Or horses that eat really fast, especially in a herd situation. If one runs another one off and they just kind of gorge, they can swallow that food that's dry without chewing it very much, and it can plug up their esophagus. And then some horses do have what we call strictures, where the esophagus can narrow over time, or they can have kind of like a blind pouch on the side where feed can pack. So there's several reasons they choke, but what happens is they'll choke, so their esophagus, the tube between their mouth and stomach, is plugged up, and they're still making saliva and swallowing that, and some of them will continue to eat. But what we see with that is food stuff coming out of the nostrils. Anytime you see hay or any grain coming out of the nostrils, that is abnormal, and your horse is choking. And depending on the tolerance of your horse or how bad the choke is, some of them will kind of act a little bit colicky. You can see like some foam coming out of their nose. They'll stick their neck straight out and kind of retch, look like they might try to throw up even though they can't. But the nasal discharge containing any feed like hay or grain or whatever you're feeding and saliva, that's a sure sign your horse is choked and needs, most of the time, needs veterinarian intervention. And even though it's kind of distressful for your horse, a lot of these will resolve on their own. So sometimes by the time we get there, he may be unchoked, but we always still pass a tube to make sure everything's cleaned out. And then the risk with choke is the esophagus is just a little opening right beside the windpipe. And when that stuff is coming back up the esophagus and out the nose, they're at risk at getting that feed down their windpipe. And that can set us up for what we call aspiration pneumonia. And those can be really, really bad. And like I said earlier, a lot of the older horses that have teeth problems, or kind of like older people, that esophagus is a big muscle and sometimes it just doesn't work as good. And a lot of older horses have some metabolic disease or Cushing's, which can really be hard for them to fight off these infections. So a lot of these we cover with antibiotics, and depending on your horse and the situation, we reach for some strong ones or not. So having your vet out for choke's always good, even if it clears up relatively quick. At least get some antibiotics if it sounds like they've aspirated. So if you see feed, saliva, hay coming out of the nose, especially right after you feed them, your horse is probably choking. Just stay calm, call your vet. We pass a stomach tube. Sometimes we got to flush the feed out of there. Sometimes we can push it through. And most of the time, these horses do just fine. And then finally, we're going to talk a little bit about foaling, because we got some foals hitting the ground. It's always concerning when a mare is pregnant, because it's amazing that baby can fit in there and come out. Most of the time, Mother Nature takes care of itself. So foaling problems are relatively rare, but when they happen, it's usually serious. So it's important to know, especially for your first time mothers or fathers, we'll call it, the first time you have a foal, like, know what's normal and know when to call the vet. So what we preach is the 1-2-3 rule of foaling, and the one is that the foal should stand within an hour. The 2 is the foal should nurse within 2 hours. And the 3 is the mare should pass the placenta or the afterbirth within 3 hours. Anything over 3 hours is considered a retained placenta, and that needs veterinary intervention right away. They're not like cows. Horses cannot walk around for days with placenta hanging out and be just fine. They can get very sick and septic and set you up for founder and laminitis. Or if the foal's not standing or nursing, that's another reason for concern. So knowing what's normal with these, the 1-2-3 rule, we can put one in the show notes that you can print. And if you can remember that, that'll get you through most of it. If your foal's not nursing, they could be sick. They could be what we call dummy foals, where they don't have that ability because of some decreased oxygen to the brain during the foaling process. Or if they can't stand up, they could have contracted tendons or be weak from some type of infection they were born with or something. So the 1-2-3 rule, your foal should stand up within an hour. It should nurse within 2 hours, and the mare should get that afterbirth out of there within 3 hours. And we like to do a veterinary exam. Even if everything goes great, we like to do an exam on these babies about 24 hours old, sometimes a little bit later if they're doing great, but we can run a little bit of simple blood work to avoid anything further down the road. We look at their joints, we look at their belly button, eyes, everything like that, and then we'll do a blood test to check to see if they got enough colostrum. The colostrum is that first milk that's real sticky, and that's got a bunch of the antibodies in there from the mare, and that's what sets your horse up to be able to fight infection. They can absorb the colostrum all the way up to 18 to 24 hours old, but once they're a day old or so, if they haven't nursed and they haven't got that colostrum, they're not going to get it from the mom. And that's when we intervene and do like a plasma transfusion to get their antibodies up. So if your foal's depressed or lethargic, call the vet. Get a temperature on that thing. Foals tend to have a bigger range, and they can't regulate their temperature too much. So it's not uncommon to see foal temperatures range all the way up to 102. But if it's over that, you need to call your vet. Or if you think they're breathing hard or straining to poop or pee, or if you see any pee come out of the stump of the umbilical cord, that's another time to call. And then we always recommend giving these foals an enema after they're born, just the saline fleet enema, just to help get that meconium, which is the first poop that comes out that's really hard and dry. And they can colic pretty quick as babies too for certain things too. So those signs of colic we mentioned earlier in the show, pawing, rolling, all of that. If you see any of that, call the vet. And most of us are not going to get mad if you call us about a foal with a little concern, because like anything else, the sooner we can intervene, the better outcomes we have. And another thing to look at with babies, not just the first day, but down the road, is look at the white part of their eyes, make sure they're not yellow, and look at their gums and stuff like that. And really keep an eye on their joints, because they can get, babies are real susceptible to what we call septic joints or infected joints, whether the infection comes through the umbilical cord or anything like that. So always a good idea to run your hand down their legs and just kind of get an idea of what your horse feels like. And then if you ever feel any of those joints swelling, call the vet right away. And same with the umbilical cord. If it gets swollen or painful, call your vet, because that can be a sign of a problem too. And diarrhea. These diarrhea can kill babies. They can get dehydrated and depressed, and they quit nursing. So if you see diarrhea, call your vet right away. And also, again, with the trailering, a lot of people, they'll call us, I can't bring it in. I don't want the mare to step on the baby. I've never seen that happen. I'm not saying it won't, but it's usually super safe to haul the mare and foal together. They really know where their legs are at. And again, in the hospital clinic setting, we can do so much more for these babies. Blood work, IV fluids. A lot of these, everybody wants their horses born early, and if it's 5 degrees in January, if we got to run fluids, we're going to make your baby hypothermic. And it's just so much better in a hospital situation. We can safely restrain the mare and everything like that. So again, have your trailer ready for emergencies. And this seems like common sense, but a lot of these emergencies are preventable. Have a safe place for your horse to be. Look at the stalls, look for any buckets that have broken plastic or the metal pieces are sticking out, nails, everything like that. But even despite your best efforts, a padded room, a horse will still hurt itself. And some of these that try to slice their leg off, some people never even find what they cut their leg on. So don't blame yourself for these if you've done everything you can. And the other thing is act promptly on these. Don't if your horse is acting colicky at noon, call your vet. Don't wait till dinner time. Don't wait till bedtime when you go back out and check on them. The sooner we can intervene with these emergencies, the better. And your horse's health and life may depend on it. And again, that's where having a relationship with a vet is great. A lot of veterinarians aren't seeing emergencies for people that aren't active clients with them, because we're all strapped and we have to take care of our active clients who use us routinely. So it's not fair to go be an hour away when one of our routine clients needs emergency care too. So I would encourage you to get a good relationship with your vet, and then they can also prescribe stuff that way too if they don't actually have to see your horse. So again, emergencies, try to stay calm. Most of these are going to be just fine. Know what's normal for your horse. Talk to your vet. Get them to teach you how to take a heart rate, respiration, temperature, digital pulse, everything like that. Get you a first aid kit. I'll have John put a list in the show notes of what would be good to put in a first aid kit. And just be prepared with a trailer, be prepared to haul the horse, and be prepared to have a budget for these emergencies too, because IV fluids and colic surgery and all that stuff isn't cheap, and it may mean the difference between life and death of your horse. So thanks for tuning in, and until next time, take care of yourself and your horses.
Veterinary surgeon or start to come quick. Draw the syringe and give it a flick. Bring your little black bag with the medicines in. Bring the trank in.